Prostate cancer is one of the most common cancers for men in the U.S., but deciding when to get screened isn't always clear. While a PSA blood test can help find it, experts often disagree on who needs one and what the results actually mean. In this medical mythbuster, Viv Williams explores why this test is debated and how it might still be a critical tool for some.
PSA stands for prostate-specific antigen. It's a protein made by the prostate gland that can be measured by a simple blood test called a PSA test.
Should I get a PSA test? Should I not get a PSA test? And I think that's at the heart of the confusion.
Doctors use the test to screen for prostate cancer because the disease can cause PSA levels to rise. Dr. Christopher Warlick, a urologist at the University of Minnesota, says other conditions that are not cancer can also make PSA numbers go up, including an enlarged prostate, which happens to men as they age, urinary retention, and inflammation. The Prostate Cancer Research website notes 3 out of 4 men with a raised PSA level will not have cancer.
Just because your PSA is elevated doesn't necessarily mean that you have cancer. And even if you do have cancer, it doesn't mean that it's one that's necessarily life-threatening.
Warlick says some prostate cancers are so slow growing that they may never cause any issues or require treatment. Plus, PSA tests sometimes result in false positives, which could lead to unnecessary biopsies or treatment. So if a PSA test isn't perfect, why should men have it?
If you are harboring a prostate cancer that has the potential to be life-threatening, identifying it as early as possible through PSA testing is going to be your best opportunity to affect a cure.
The United States Preventative Services Task Force recommends men ages 55 to 69 who are not at increased risk of prostate cancer talk to their healthcare providers about whether or not to have PSA screening.
I do strongly advocate that people consider getting a PSA test in the right context, and this is really important.
Dr. Warlick says men who have a family history of prostate cancer, have had prostate cancer, or are of African American descent may be at increased risk of the disease and should have PSA tests.
We think that PSA testing helps us identify disease perhaps 6 to 10 years earlier in the natural history of the disease than we would have detected it otherwise.
What are normal PSA levels? Warlick says that depends on your age because levels raise as you get older. But generally, anything above 4 means there may be something going on, and depending on a man's risk factors and general health, further testing, such as an MRI or biopsy, may be warranted. So yes, PSA testing can be confusing, but
for some men, it can be a lifesaver.
With this medical mythbuster, I'm Viv Williams.
But there's a lot of controversy among physicians because some people feel like you should, some people feel like you should not because of the false positive rates. But you just have to recognize the earlier you catch any disease, the better outcome most times you have. And that's really the whole point of a screening. It doesn't mean it's going to be positive, but you also can be overwhelmed. You know, when people get a positive, they're like, oh. But other things will cause a PSA because it's just a protein. And so many things do cause it. Enlarged prostate as you get older, infection, inflammation, which a lot of people have inflammation, but some things that people don't realize is most of the time it's just a smoke alarm.
So, but I'm not a false
real.
positive I'll take any day of the week. So 75% of those positives are finding out later there's nothing to worry about. There's no fire. But that 25%, we're going to get the fire before it's an inferno. And I love that analogy.
Yeah.
Yeah,
So, well, I mean, I think just people want to know, you know, but you have to educate them and let them know. Just because it's high doesn't mean you have cancer.
Well, it's the importance, listening to you, I think it's so important to know all those layers behind one screen. I mean, I'm built the same way you are. I would get screened, not being a guy, but I would get screened just in case. But then not knowing all the other things that could have caused a false positive. You know, you could live with a lot of uncertainty and fear if you got a false positive until the next results came back.
Yeah.
And then you have a happy day.
Right.
All right, great discussion. We'll be right back with more on Aging Untold.